Doctor arrives early and freezes upon seeing what the nurse did to the elderly patient. Sarah Jenkins took a deep breath before entering room 312. The patient, Martha Harrison, had gone 3 weeks without uttering a single word, refusing to eat and ignoring any attempt at contact. What no one knew was that Sarah had discovered something that could change everything. That's when she picked up the small, colorful spray bottle she had brought hidden in her bag. Martha was lying down, staring at the ceiling with that empty expression that had been tormenting the medical team for days. Sarah pulled the trigger and sprayed a few drops of ice-cold water on the elderly woman's face. The result was instantaneous. Martha blinked, turned her head, and for the first time in weeks sketched something that looked like a smile. Sarah felt her heart race. It worked. It really worked. "Mrs. Martha," whispered Sarah, approaching the bed. "Can you hear me?" The elderly woman moved her lips slightly, but no sound came out. Even so, for the first time since her admission, there was life in her eyes. Sarah sprayed a few more drops, this time on the patient's neck. "I knew you were in there," said Sarah, holding Martha's wrinkled hand. "I just needed to find a way to wake you up." What Sarah didn't notice was that Dr. Richard Mitchell had arrived at the hospital 2 hours earlier that morning. He wanted to review some charts before his official shift began, especially Martha's, which was becoming a concerning case. Richard was walking down the hallway when he heard voices coming from room 312. He stopped, intrigued. Martha hadn't spoken to anyone since she arrived at the hospital after her husband's passing. Curious, he approached the slightly open door. What he saw left him completely shocked. Sarah was there, with a colorful water gun in her hands, spraying water on the face of a 78-year-old patient. His first impulse was to go in and confront her immediately. That was totally against hospital protocols, but then he saw something that made him stop. Martha was smiling, not just an involuntary movement of facial muscles, but a genuine smile accompanied by a sparkle in her eyes that he hadn't seen in weeks. "My God," murmured Richard to himself, watching through the crack in the door. Sarah continued talking quietly with the patient, explaining every move she made. Martha responded with small gestures, nods of her head, and even attempts to speak. It was as if she were coming back to life before the doctor's eyes. Richard took a few steps back, needing to process what he had just witnessed. Sarah Jenkins was one of the most dedicated nurses at the hospital, but what she was doing was completely irregular. At the same time, the results were undeniable. He thought of all the treatments they had tried with Martha: antidepressants, occupational therapy, consultations with psychologists. Nothing had worked, and now a nurse with a toy water gun was achieving what the entire medical team had not. "Dr. Richard?" The voice of head nurse Margaret Vance echoed down the hallway. "You're early today." Richard turned, trying to disguise the confusion he felt. Margaret was known for her extreme rigidity and zeal for hospital regulations. If she found out what Sarah was doing, the nurse would be fired on the spot. "I wanted to review some cases," replied Richard, trying to sound natural. "Have you seen Nurse Sarah around here?" "She's taking care of the patient in 312, said Margaret, consulting her clipboard. "Martha Harrison. Difficult case, that one. I'm already considering transferring her to the psychiatric unit." Richard felt a chill in his stomach. If Martha were transferred now, just when Sarah had found a way to reach her, it would be a disaster. "Maybe we should wait a few more days," suggested Richard. "Sometimes these cases of deep grief take time to resolve themselves." Margaret looked at him suspiciously. Richard had never advocated for prolonging unnecessary hospital stays. In fact, he was known for his efficiency in discharging patients quickly. "Doctor, with all due respect, but the patient has been occupying a bed for 3 weeks without showing any improvement," insisted Margaret. "The hospital's resources are limited." At that moment, they heard a noise coming from room 312. It sounded like a muffled laugh. Margaret and Richard exchanged surprised glances. "Did that come from Mrs. Martha's room?" asked Margaret, marching toward the door. Richard followed her, his heart racing. If Margaret caught Sarah with the water pistol, it would be the end of the nurse's career. But when they entered the room, Sarah was just checking the patient's vital signs, who seemed more alert than she had been in weeks. "How is our patient today?" asked Richard, observing carefully. "She's been more responsive this morning," replied Sarah, discreetly tucking the water pistol into her lab coat pocket. "I managed to get her to drink a little water a few minutes ago." Margaret approached the bed and observed Martha closely. The elderly woman really did seem different. Her eyes were focused, and she was responding to visual stimuli. "Martha," called Margaret loudly, "can you hear me?" To everyone's surprise, Martha turned her head toward the voice and gave a slight nod. It was the first conscious response she had given since being admitted. "Interesting," murmured Richard, trying to disguise his excitement. "Sarah, did you do something different today? Any new procedure?" Sarah hesitated for a moment, her eyes meeting Richard's. She realized he knew something, but couldn't decipher whether he was on her side or not. "I just talked to her more today," Sarah answered carefully. "Sometimes I think patients just need to feel that someone cares." Margaret rolled her eyes. She had never approved of what she called the emotional methods of some nurses. For her, medicine was science, not sentimentality. "Well, whatever you did, keep it up," said Richard, surprising both Sarah and Margaret. "I want to see her progress throughout the day." After Margaret left the room, Richard remained for a few moments, observing Martha. The woman was clearly more present, more connected to her surroundings. "Sarah," Richard said quietly, making sure they were alone, "I saw what you did." Sarah's blood ran cold. She knew her career was over. After 5 years working at that hospital, building a reputation for dedication and competence, everything would be destroyed by an act of desperation. "Doctor, I can explain," began Sarah, her voice trembling. "You don't need to explain," interrupted Richard. "You need to show me how it worked." Sarah looked at him with surprise and confusion. She had prepared for a reprimand, perhaps even a summary dismissal. She wasn't expecting scientific curiosity. "You're not going to fire me?" she asked, still incredulous. "Sarah, I have 20 years of medical career," said Richard, sitting in the chair next to the bed. "And for the last 3 weeks our entire team has tried everything to help Martha. You achieved in 1 morning what we couldn't in 21 days. Richard paused, watching the patient who now seemed to be following the conversation with her eyes. "I want to understand how you knew this would work," he continued, "and I want to know if it can be applied to other patients." Sarah was still processing the doctor's unexpected reaction. She had prepared for the worst, and now Richard seemed genuinely interested in her method. "The truth is, it was kind of an accident," admitted Sarah. "Yesterday, when I was cleaning her room, I knocked over a glass of water that splashed on her face. For a second she reacted. It was just a moment, but it was the first reaction I've seen since she arrived." Richard nodded, encouraging her to continue. "So I started researching sensory stimuli for patients in severe depressive states," continued Sarah. "I read about how small thermal or tactile shocks can help reconnect people who are psychologically isolating themselves." "And where did you get that water pistol?" asked Richard. Sarah hesitated again. The truth was even more irregular than Richard imagined. "I brought it from home," she confessed. "It's my nephew's. I thought if it worked I could suggest it officially to the medical team." Richard was impressed by the nurse's initiative. She had risked her career to try something no medical protocol would suggest, but which was showing concrete results. At that moment, Martha made a sound that caught both of their attention. It was faint, almost inaudible, but it definitely seemed like an attempt to speak. "Martha?" Sarah approached the bed. "Sarah, do you want to say something?" The elderly woman moved her lips with effort, trying to form words. Richard and Sarah leaned in to hear better. "Wah! Tear," Martha managed to whisper, her voice hoarse from disuse. "She wants water," said Sarah, moved. It's the first word she's spoken in 3 weeks. Richard watched as Sarah helped the patient take small sips of water. It was incredible how such a simple intervention had yielded such significant results. "Sarah, I want you to document everything you're doing," said Richard. "I want to know exactly how you apply the stimuli, the frequency, the patient's reaction. This could be revolutionary. Dear listener, if you're enjoying the story, please take a moment to like and especially subscribe to the channel. It really helps us who are just starting out. Now, continuing." Sarah felt a mix of relief and excitement. Not only would she not be punished, but Richard wanted to turn her accidental discovery into something official. "But what about Margaret?" asked Sarah, worried. "If she finds out I'm using unapproved method—" "Leave Margaret to me," said Richard with determination. "If the results continue to be positive, it will be hard for her to argue against it." For the rest of the morning, Sarah applied the water treatment 2 more times, always under Richard's discreet supervision. With each application, Martha became more responsive, even forming a few words and making small gestures with her hands. By around noon, Richard was convinced he had witnessed something exceptional. He decided it was time to include other members of the medical team, but strategically. "Dr. Thomas," Richard called to the neurologist passing in the hallway, "could you take a look at the patient in 312? I'm noticing some interesting changes." Dr. Thomas Miller entered the room preparing for another routine examination of a depressed patient. What he found completely surprised him. "Richard, is this the same patient who was in a catatonic state last week?" asked Thomas, observing Martha, who was following his movements with her eyes. "The same," confirmed Richard. "Martha, can you squeeze my hand?" To Thomas's astonishment, the elderly woman made a visible effort and managed to weakly squeeze Richard's hand. "What medication did you change?" asked Thomas, consulting the medical chart. Richard exchanged a look with Sarah. They had agreed they would reveal the method only if it was necessary for the continuation of the treatment. "Actually, we haven't changed any medication," said Richard. "Nurse Sarah has been applying some unconventional sensory stimuli." Thomas looked at Sarah with curiosity and then back at the patient. The improvement was undeniable, but he couldn't understand how simple sensory stimuli could produce such dramatic results. "What kind of stimuli?" asked Thomas. Sarah looked at Richard, who nodded encouragingly. "I've been using room temperature water spray to create small sensory shocks," explained Sarah. "The theory is that these unexpected stimuli can help reconnect patients who are psychologically isolating themselves." Thomas remained silent for a few moments, processing the information. As a neurologist, he knew sensory stimuli could have surprising effects on the brain, especially in cases of severe depression. "And have you been documenting her reactions?" asked Thomas. "We started today," replied Richard, "but the results have been consistent with each application." Thomas approached Martha and performed some basic neurological tests. The patient responded to all of them, something that hadn't happened in weeks. "This is fascinating," murmured Thomas. "Richard, would you mind if I followed this case more closely? I'd like to better understand the mechanism behind this recovery." Richard smiled. He was managing to build a support team for Sarah's method without having to directly confront administrative resistance. "Of course, Thomas," said Richard. "In fact, I was thinking of expanding this approach to other similar patients." At that moment, the door to the room swung open abruptly and Margaret entered with a serious expression. She had noticed the unusual movement of doctors in room 312 and had come to investigate. "What's going on here?" asked Margaret, looking suspiciously at the impromptu meeting. "We were discussing the patient's surprising progress," replied Richard, keeping calm. Dr. Thomas wanted to evaluate the neurological changes. Margaret approached the bed and observed Martha carefully. It was undeniable that the patient was much more alert and responsive than in previous days. "What medication changes did you make?" asked Margaret, picking up the medical chart. "No medication changes," said Thomas. "The improvement seems to be related to therapeutic stimuli applied by Nurse Sarah." Margaret looked at Sarah with an expression that mixed surprise and suspicion. "What kind of therapeutic stimuli?" she asked, her voice laden with skepticism. Sarah took a deep breath. She knew this moment would come, and now she needed to defend her method before the most rigid person in the hospital. "I've been using aquatic sensory stimuli for psychological reconnection," said Sarah, trying to sound as professional as possible. "They are controlled applications of room temperature water to stimulate neurological responses." Margaret processed the explanation for a few seconds. She couldn't find technical flaws in the description, but her intuition told her there was something more behind those elaborate words. "And is this method documented in any medical protocol?" asked Margaret. Richard intervened before Sarah could answer. "Margaret, we are working on documenting the results," he said. "What matters is that we have a patient who was in critical condition 3 weeks ago and is now showing clear signs of recovery." "Martha," called Thomas, addressing the patient directly. "Can you tell me your name?" Everyone present fell into absolute silence, waiting for a response that could change the entire course of the discussion. "Martha," whispered the elderly woman, her voice weak but clear. Margaret was visibly shocked. It was the first time the patient had answered a direct question since admission. "And do you know where you are?" continued Thomas. "Hospital," replied Martha, making a considerable effort. Margaret's reaction was immediate. She knew that, regardless of the method used, the results were undeniable. As head nurse, she couldn't ignore such a significant improvement. "Sarah," said Margaret, her voice softer than usual, "I want you to explain to me exactly what you've been doing with this patient." Sarah realized the moment of truth had arrived. There was no point in using technical terms or trying to disguise things any longer. It was time to be completely honest. "I use a toy water pistol," said Sarah, pulling the colorful object from her pocket. "I spray small amounts of water on her face and neck to create unexpected sensory stimuli." The silence that followed was deafening. Margaret looked at the colorful water pistol as if she were seeing an alien object. "Are you telling me you've been treating a geriatric patient with a toy?" asked Margaret, her voice rising an octave. "Margaret," Richard intervened quickly, "the method may seem unconventional, but the results speak for themselves." "Results?" exploded Margaret. "Richard, this is a serious violation of all hospital protocols. We can't have nurses playing with water pistols with elderly patients." Thomas tried to mediate the situation. "Margaret, from a neurological standpoint, unexpected sensory stimuli can indeed have therapeutic effects," he said. "What matters is that the patient is responding positively." "I don't care about neurological theories," retorted Margaret. "What matters is that we have regulations and protocols for a reason. We can't simply ignore them because someone had a creative idea." Martha, who had followed the entire discussion with attentive eyes, made a sound that caught everyone's attention. "Please," she whispered, her voice weak but determined. Everyone turned to the patient, surprised by the intervention. "She helped me," continued Martha, making a visible effort to form each word. Margaret was speechless. The patient herself was defending the nurse's method. "Martha," said Margaret, her voice suddenly gentler, "did you like what Sarah did?" The elderly woman made an affirmative movement with her head, and for the first time in weeks, she gave a genuine smile. "Water? Good," she said, looking directly at Sarah. At that moment, the tension in the room changed completely. It was impossible to argue against a patient who was clearly better and who expressed gratitude for the treatment received. "Richard," said Margaret, clearly conflicted, "I need to report this to the administration. I can't simply ignore that unauthorized methods are being used." "I understand your position," said Richard, "but before making any report, how about we document the results for a few more days? If it really works, perhaps we can establish an official protocol." Margaret hesitated. Her rigid training urged her to report the irregularity immediately, but her experience as a healthcare professional made her value any method that brought positive results for patients. "3 days, she finally said. "You have 3 days to document everything and present me with convincing scientific results. If you can't, I'll have to take appropriate measures." After Margaret left, Richard, Thomas and Sarah remained in the room, processing the ultimatum they had received. "3 days isn't much time," said Thomas, "but if we can properly document Martha's progress and perhaps apply the method to a few more patients—" "Do you think we should risk it with other patients?" asked Sarah, worried. "If anything goes wrong, my career is over." Richard reflected for a moment. He knew Sarah was right to worry, but he also knew they had a unique opportunity to revolutionize the treatment of depressed geriatric patients. "Sarah, do you know other patients in the geriatric wing who could benefit from this method?" asked Richard. Sarah thought of the patients under her care. There were at least 2 other people showing symptoms similar to Martha's. "There's Mr. Arthur in room 315, she said. He's been here for 2 weeks, completely apathetic since his wife passed away, and Mrs. Dorothy in 318, who fell into depression after a fall that left her bedridden." "Perfect," said Thomas. "If we can get positive results with 3 different patients, we'll have more convincing statistical data." Richard nodded in agreement. "But we need to be very careful," he warned. "If any of the treatments go wrong, not only Sarah will be at risk, but all of us." For the rest of the afternoon, they carefully planned how to apply the method to the other patients. Thomas would suggest the new treatments as experimental sensory stimulation therapy, while Richard would directly supervise all applications. Around 5 in the afternoon, Sarah went to room 315, where Arthur Jenkins was hospitalized, a 72-year-old man who had lost his wife of 50 years just 1 month before. He was lying down, staring at the wall, completely ignoring the nurse's presence. "Mr. Arthur?" called Sarah gently. "How are you feeling today?" There was no response. Arthur continued looking at the wall as if Sarah didn't exist. Richard entered the room discreetly and signaled for Sarah to proceed. She took the water pistol from her pocket and positioned herself beside the bed. "Mr. Arthur, I'm going to apply a treatment that may help you feel better," explained Sarah, even knowing he probably wasn't listening. She sprayed a few drops of water on the elderly man's face. The reaction was immediate and surprising. Arthur blinked several times and turned his head towards Sarah. "What?" he began, his voice hoarse from disuse. Richard approached the bed, trying to contain his excitement. Once again, the method had worked. "Mr. Arthur, my name is Dr. Richard," he said calmly. "Can you hear me?" Arthur looked at him confused, as if waking from a deep sleep. Where is Evelyn?" he asked, referring to his deceased wife. Richard and Sarah exchanged glances. It was an expected question, considering the patient's psychological state, but it was also a sign that he was returning to reality. "Mr. Arthur, you're in the hospital," Sarah explained gently. "You've been here for 2 weeks to treat depression." The elderly man looked around the room as if seeing everything for the first time. His expression shifted from confusion to deep sadness as reality began to form again in his mind. "Evelyn, she's gone, isn't she?" he asked, tears beginning to form in his eyes. "Yes, Mr. Arthur," said Richard with compassion. "But you are alive and need to take care of your health." Arthur remained silent for a few minutes, processing the information. Then, to everyone's surprise, he tried to sit up in bed. I want to see my house," he said, his voice gaining strength. Richard helped him position himself better in bed. It was incredible how, in just a few minutes, Arthur had gone from a catatonic state to expressing specific wishes and needs. "Mr. Arthur, you still need to stay here for a few days," explained Richard. "But if you keep improving like this, you can go home soon." "How many days have I been here?" asked Arthur, showing awareness of time for the first time. 2 weeks, replied Sarah. "You arrived right after Mrs. Linda's funeral." Arthur closed his eyes and sighed deeply. The memories were returning, and with them, all the pain of the loss. But at the same time, he seemed to be processing reality in a healthier way. "I remember arriving here," he said slowly. "But after that, it's all very confusing, like I was sleepwalking." Richard took detailed notes on Arthur's reaction. The patient's account confirmed theories about dissociative states in cases of extreme grief. "Mr. Arthur, we will apply this treatment a few more times in the coming days," explained Sarah. "It seems to be helping you reconnect with the present." "What is this treatment?" asked Arthur, noticing the water pistol in Sarah's hand. Sarah hesitated, but Richard encouraged her to be honest. "It's water sprayed on the face," she explained. "It seems strange, but it helps stimulate the brain in a way other treatments can't." Arthur looked at the colorful pistol and surprisingly smiled slightly. "My grandson has one just like it," he said. "He always got me wet when we played in the backyard." Sarah felt a pang in her heart. Unknowingly, she had used an object that reconnected Arthur with happy memories of his family. "Maybe that's why it works," she murmured to Richard. "It's not just the physical stimulus, it's the emotional memory the object awakens." Richard nodded, fascinated by the psychological complexity of the treatment they were discovering. After making Arthur more comfortable, They headed to room 318 to find Dorothy Campbell, a 76-year-old woman who had fallen into severe depression after a fall that resulted in a hip fracture. Dorothy was awake, but completely apathetic. She hadn't spoken to anyone since the surgery, 3 weeks prior, and refused to participate in physical therapy sessions. "Mrs. Dorothy?" called Sarah, approaching the bed. "How are you feeling?" As expected, there was no response. Dorothy stared fixedly at her own hands, completely ignoring the presence of other people in the room. Richard watched as Sarah prepared the water pistol. They were about to test the method for the 3rd time that day, and the results would determine if they had convincing data to present to Margaret. Sarah sprayed water on Dorothy's face, who blinked in surprise and raised her eyes for the first time in days. Who did that?" asked Dorothy, her voice stronger than Martha's or Arthur's. "It was me, Mrs. Dorothy," replied Sarah. "My name is Sarah. I'm your nurse." Dorothy looked at Sarah with an expression of confusion and then observed the environment around her. "Why am I wet?" she asked. Richard approached, introducing himself as the doctor in charge of the case. "Mrs. Dorothy, you've been in the hospital for 3 weeks," he explained. "You had a fall and needed hip surgery." Dorothy tried to move in bed and winced in pain. "Oh, yes," she said, the memories gradually returning. "I fell on the stairs at home. What terrible pain." "The surgery was successful," assured Richard. "With physical therapy, you'll be able to walk normally again." "Physical therapy?" asked Dorothy, seeming genuinely interested for the first time in weeks. "Yes," said Sarah, "but you've been refusing to participate in the sessions." Dorothy reflected for a moment, as if trying to remember why she had refused to cooperate. I think I thought it wasn't worth it," she said slowly. "Like nothing else mattered." Richard recognized the classic symptoms of post-surgical depression in the elderly. It was a common condition, but one that rarely responded so quickly to any kind of treatment. "And now?" asked Richard. "How do you feel now?" Dorothy thought carefully before answering. "Different," she said, as if I had woken from a nightmare. It still hurts, but it feels worth trying to get better." Sarah and Richard exchanged meaningful glances. They were 3 patients, 3 different stories, but all with similar responses to the same treatment. "Mrs. Dorothy, we would like to continue applying this treatment for the next few days," explained Richard. "Would you mind?" "The water treatment?" asked Dorothy. "It was strange, but it somehow helped me." "Yes, you can continue." When they left Dorothy's room, Richard was euphoric, but also worried. The results were too surprising to be a coincidence, but also too difficult to be easily accepted by the traditional medical community. "Sarah, we have something revolutionary here," he said. "But we also have a problem. How do we scientifically explain why a toy water gun is more effective than conventional medications and therapies?" Sarah had been thinking about this all day. Her intuition told her the secret was in the combination of several factors. "Dr. Richard, I have a theory," she said. "It's not just the water. It's the surprise, it's the colorful object that awakens memories. It's the feeling that someone is trying something different to help." "Go on," encouraged Richard. "These patients were all isolated in their own worlds of sadness," continued Sarah. "Medications treat symptoms, conventional therapy uses words, but this breaks the isolation in a completely unexpected way." Richard nodded, beginning to see the logic behind the method's success. "It's like a sensory reset," he murmured. "Something so unexpected it forces the brain to return to the present." They spent the rest of the afternoon meticulously documenting all the reactions of the 3 patients. Richard created charts comparing the states before and after treatment, while Sarah noted every detail about the application of the stimuli. The next day, Margaret arrived at the hospital, determined to personally verify the results that Richard and Sarah claimed to have achieved. She began her inspection in room 312, where Martha was eating breakfast alone for the first time in weeks. "Martha," called Margaret, entering the room, "how are you feeling today?" "Better," answered Martha, her voice firmer than the day before. "I managed to sleep through the night without waking up." Margaret was impressed with the improvement in the patient's articulation and lucidity. "And the treatment that Sarah has been doing?" asked Margaret. "How do you feel about it?" Martha smiled, a genuine smile that lit up her wrinkled face. "She woke me up," said Martha simply. "I was lost and she brought me back." Margaret proceeded to room 315, where she found Arthur sitting on the bed, flipping through a magazine. "Mr. Arthur," she called, "I heard you are feeling better." "Much better," confirmed Arthur. "Yesterday, I asked them to call my daughter. I want to see her." "And when was the last time you wanted to see your family?" asked Margaret. Arthur thought for a moment. "Since I arrived here, yesterday was the first time," he admitted. "Before that, I didn't want to see anyone. I didn't even really know where I was." Margaret's last stop was room 318, where Dorothy was doing light exercises in bed, as instructed by the physical therapist. "Mrs. Dorothy," said Margaret, "I see you are participating in physical therapy." "Yes," Dorothy replied animatedly. "The physical therapist said if I push myself, I might be able to walk without assistance in a few weeks. I really want to go back home." Margaret completed her rounds completely confused. 3 patients who had been in critical states were now showing clear signs of recovery. It was impossible to deny the results, no matter how ridiculous the method seemed. She found Richard in his office, analyzing the collected data. "Richard," she said, sitting down heavily in the chair, "I don't understand what's happening." "What do you mean?" asked Richard, though he knew exactly what Margaret's confusion was. 3 patients who were practically given up on are now talking, eating, participating in treatment, said Margaret. And it all started after a nurse decided to play water gun with them. Richard closed the file he was analyzing and looked directly at Margaret. "Margaret, sometimes medicine can't be explained by protocols and medications alone," he said. "Sometimes healing comes from unexpected places." "But Richard, we are healthcare professionals," argued Margaret. "We can't base our treatments on games." "It's not a game," Richard countered. "It's a method that's working. 3 patients improved drastically in 24 hours. That's more than any antidepressant medication could achieve." Margaret remained silent, clearly conflicted between her rigid training and the undeniable results she had witnessed. "What do you suggest I do?" she finally asked. "How about talking to Sarah?" suggested Richard. "Let her explain the reasoning behind the method. Maybe you'll better understand how it works." Margaret reluctantly agreed. She found Sarah in the nurses' station, organizing medications for the afternoon shift. "Sarah," called Margaret, "I need to talk to you about these treatments you've been applying." Sarah stopped what she was doing and turned to face the supervisor. She knew this moment would come and she was prepared to defend her method. "Of course, Margaret," said Sarah. "What would you like to know?" "First, I want you to explain to me how you got the idea to use a water gun on geriatric patients," said Margaret, trying to maintain a professional tone. Sarah took a deep breath and began to tell the whole story, from the accident with the water glass to her research on sensory stimuli. "And you didn't think it necessary to consult the medical team before testing this?" asked Margaret. "I knew if I asked for permission it would be denied," admitted Sarah. "But I also knew that if I didn't try something different, those patients would continue to suffer indefinitely." Margaret appreciated Sarah's honesty, even if she didn't agree with her methodology. "Sarah, you understand that what you did was a serious violation of protocols," said Margaret. "Regardless of the results, you can't just invent treatments without authorization." "I understand," said Sarah, "and I accept the consequences, but I don't regret helping those patients." The conviction in Sarah's voice impressed Margaret. She had known many professionals throughout her career, but few had shown such genuine dedication to patient well-being. "Margaret," Sarah continued, "I've worked here for 5 years. I've never had any disciplinary problems, never compromised any patient's safety. I just wanted to find a way to help people who seemed lost." Margaret reflected on Sarah's words. She knew the nurse was right about her impeccable professional record. She also knew the results obtained were extraordinary. "Sarah, I still don't know what to do with this situation," admitted Margaret, "but I acknowledge that you achieved something our entire team wasn't achieving. What do you need to feel comfortable with this?" asked Sarah. Margaret thought carefully before answering. "I need proper scientific documentation," she said. "I need a psychologist to evaluate the patients and confirm the improvements. And I need guarantees that the method is safe for continued use." "That can be arranged," said Sarah. "Dr. Richard is already documenting everything, and Dr. Thomas has confirmed the neurological benefits." "And the water gun?" asked Margaret. "We can't have nurses carrying toys through the hallways." Sarah smiled. She had thought about that too. "What if we turned this into official medical equipment?" she suggested. "We can use proper sprayers, create specific protocols, train the staff properly." The idea intrigued Margaret. If they could formalize the method, remove the appearance of improvisation, and create proper procedures, perhaps it would be possible to officially incorporate it into the hospital. "Sarah, I'm going to give you a few more days to organize all of this," said Margaret. "But I want complete documentation, psychological evaluation of the patients, and a formal protocol for applying the treatment." Sarah felt a wave of relief. Margaret was no longer completely resisting the idea. There was a real chance to turn her accidental discovery into something officially recognized. During the following days, Sarah worked intensively with Richard and Thomas to create the necessary documentation. They contacted the psychologist Dr. Jennifer Brooks to evaluate the 3 patients and confirm the psychological improvements. Dr. Jennifer arrived at the hospital skeptical about the claimed results. As a clinical psychologist with 20 years of experience, she had seen many promises of miracle treatments that turned out to be illusory. "Dr. Richard," she said upon arrival, "I've heard surprising things about rapid recoveries of depressed patients. I must admit I'm skeptical." "I understand your position," replied Richard. "I myself was shocked when I witnessed the results, but I'd like you to evaluate the patients personally before forming any opinion." Dr. Jennifer began her evaluation with Martha. During an hour-long conversation, she applied several standard psychological tests to measure levels of depression, anxiety, and temporal awareness. "Martha, can you tell me how you felt before starting this new treatment?" asked the psychologist. "It was as if I were in a dark hole," replied Martha, articulating her thoughts clearly. "I couldn't see anything but sadness. I didn't even know who I was anymore." "And now? How do you feel?" continued Dr. Jennifer. "I'm still sad about losing my husband," said Martha, "but now I can see that life goes on. I want to get better. I want to go home. I want to see my grandchildren." Dr. Jennifer took detailed notes. The mental clarity and temporal perspective demonstrated by Martha were incompatible with a picture of severe depression. The evaluation of Arthur revealed similar results. He was processing grief in a healthier way and showed interest in future activities. "Dr. Jennifer," said Arthur during the consultation, "I know Evelyn is gone and she's never coming back. That hurts a lot. But I also know she wouldn't want to see me wasting away in a hospital bed." With Dorothy, the results were even more impressive. She had not only regained interest in rehabilitating herself, but was also making specific plans for her life after hospital discharge. "Doctor," said Dorothy, "I've already spoken with my daughter. When I leave here, we're going to renovate my house to make it safer. I don't want to go through this again." After completing all the evaluations, Dr. Jennifer met with Richard, Thomas, Sarah, and Margaret to present her conclusions. "I must admit I'm perplexed," she began. "From a psychological standpoint, these 3 patients no longer exhibit symptoms compatible with severe depression." Margaret leaned forward, interested in the technical conclusions. "What exactly does this mean?" asked Margaret. "It means there has been genuine and significant improvement in all cases," explained Dr. Jennifer Brooks. "It's not a placebo effect. It's not superficial improvement. It's a real change in how they process emotions and future perspectives." "And can you explain how this happened?" asked Thomas. Dr. Jennifer Brooks hesitated for a moment. "Theoretically, unexpected sensory stimuli can interrupt negative neurological patterns," she said. "But the speed of this recovery is extraordinary. Normally, changes like this would take weeks or months of intensive therapy." Richard then presented all the medical data they had collected, including charts comparing the patient's states before and after treatment. "Margaret," said Richard, We have medical evidence, psychological evidence, and direct testimonies from the patients. All point to the effectiveness of Sarah's method. Margaret studied all the presented documents carefully. Her initial resistance was gradually being overcome by the amount of positive evidence. "And what about the issue of formalization?" she asked. "We can't officialize a treatment based on toys." Sarah then presented her proposal to professionalize the method. "I've researched specific medical equipment for aquatic stimulus therapy," she said, showing catalogs from medical suppliers. "There are appropriate sprayers with pressure and temperature control. We can create specific protocols, application frequencies, patient selection criteria." Thomas complemented with the scientific foundation. "We can frame this as sensory reconnection therapy," he suggested. "It's a recognized field of neurology. We're just applying it in an innovative way." The meeting stretched through the entire afternoon, with each participant contributing to create an official framework for Sarah's method. Margaret gradually became convinced that it was possible to transform an accidental discovery into a legitimate medical protocol. "Very well," said Margaret finally. "I will take this proposal to the hospital's board. If they approve, we can implement an official pilot program." Sarah could hardly believe what she was hearing. What had started as a desperate act to help a patient was turning into a recognized medical innovation. "But I want to make one thing clear," continued Margaret, looking directly at Sarah. "If this is approved, you will be the technical lead for the program. That means proper team training, rigorous protocols, and documentation of every case." "I completely accept," replied Sarah without hesitation. Richard smiled, satisfied with the outcome of the situation. In just a few days, they had turned a protocol violation into an opportunity for medical innovation. Dear listener, if you are enjoying the story, please take a moment to like and especially subscribe to the channel. It helps us a lot as we are just starting out, now continuing. 2 days later, Margaret returned with the answer from the hospital's board. Dr. William Foster, the clinical director, had been intrigued by the proposal and decided to implement a 3-month pilot program. "The administration has approved," announced Margaret during a meeting with the whole team. "But there are specific conditions." Sarah felt a mix of excitement and nervousness. They would finally have the chance to apply the method officially, but she knew the responsibility would be enormous. "First," continued Margaret, "all equipment must be approved by the Health Standards Bureau. Second, all professionals involved need to undergo specific training. Third, every case must be meticulously documented." Richard nodded, satisfied with the presented conditions. "This is more than we hoped for," he said. "When can we begin?" "As soon as we receive the proper equipment," replied Margaret. "Sarah has already placed orders with certified medical suppliers. During the following weeks, Sarah worked intensively to prepare the pilot program. She created procedure manuals, safety protocols, and patient selection criteria. She also organized training sessions for other nurses interested in learning the method. The first official training took place in the hospital's conference room, with the participation of 8 nurses from the geriatric wing. Sarah was nervous, but determined to properly convey the fundamentals of her discovery. "What you will learn is not just a technique," Sarah began. "It's a philosophy of care that places human reconnection at the center of treatment." She explained in detail the theory behind sensory stimuli, the types of patients who could benefit, and the necessary precautions for safe application. "Nurse Rachel," said Sarah, addressing one of the participants, "have you worked with patients experiencing post-surgical depression?" "Yes," replied Rachel. "It's always very frustrating. They stop cooperating with treatment, even knowing it harms their recovery." "Exactly," confirmed Sarah. "Our approach aims to break that cycle of disconnection before it becomes chronic." The training included practical sessions with volunteers, simulations of different clinical scenarios, and discussions about the ethical aspects of treatment. Sarah wanted to make sure everyone understood both the technique and the responsibility involved. Nurse Stephen, one of the most experienced participants, raised an important concern. "Sarah, how do we explain this to families?" he asked. "I imagine some relatives might be confused to see water being sprayed on their loved ones." "Excellent question," replied Sarah. "Communication with family members is crucial. We always explain that it is a sensory stimulation therapy. approved by the hospital and supervised by doctors. During the first weeks of the pilot program, they treated 15 new patients. The results varied, but most showed significant improvements. Sarah meticulously documented each case, creating a valuable database on the method's effectiveness. One of the most touching cases was that of Mrs. Beatrice, an 82-year-old lady who had fallen into depression after learning she would need to move to a nursing home. She refused to speak with her children and had stopped eating properly. "Mrs. Beatrice," said Sarah during the first application of the treatment, "I'm going to use a little water to help you feel better." The initial reaction was irritation. Beatrice complained about getting wet and demanded that Sarah stop immediately. But a few minutes later, she began asking questions about the treatment. "Why do you do this?" asked Beatrice, wiping her face with a towel. "Because we want you to feel present again," explained Sarah. "We've noticed that when people are very sad, they disconnect from the world around them." "And how does the water help?" continued Beatrice, showing curiosity for the first time in days. Sarah patiently explained the theory of sensory stimuli and how they could help the brain reconnect with the present. "Interesting," murmured Beatrice. "When I was a teacher, we used similar techniques with children who had trouble concentrating." This revelation opened a new perspective for Sarah. Beatrice had been an educator for 40 years and had practical experience with attentional reconnection methods. "Would you like to tell me more about those techniques?" asked Sarah. Beatrice spent the next hour detailing her career as a teacher, her experiences with special needs children, and innovative pedagogical methods. It was the first time she had spoken with enthusiasm since being admitted. "You know, Sarah," Beatrice said at the end of the conversation, "perhaps I can contribute to this program of yours. I have many ideas about how to apply stimuli in different situations." From that day on, Beatrice became an active collaborator in the program. She offered valuable insights into behavioral psychology and even helped train new nurses. Her transformation was so dramatic that she decided to postpone the move to the retirement home and continue living independently. The success of cases like Beatrice's caught the attention of other departments at the hospital. Dr. Susan Reynolds, head of pediatrics, sought out Sarah to discuss the possibility of adapting the method for hospitalized children. "Sarah," said Dr. Reynolds, "I've been following the results of your program in geriatrics. Do you think this approach could work with children who develop severe hospital anxiety?" The question intrigued Sarah. She had been so focused on elderly patients that she hadn't considered other possible applications. "We would need to completely adapt the approach," Sarah replied. "Children have very different needs and reactions than the elderly." "Exactly," agreed Dr. Reynolds, "but the principle of reconnection through playful stimuli could be very effective with traumatized children." They spent several hours discussing possible adaptations of the method for a pediatric audience. Dr. Reynolds suggested using more colorful elements, fun sounds, and even pleasant aromas to create a broader sensory experience. "How about we start with a small pilot project?" suggested Sarah. "We can select a few children with severe anxiety cases and test specific adaptations." Dr. Reynolds enthusiastically agreed. They planned to implement the project as soon as the pilot program in geriatrics was officially approved. Meanwhile, Sarah's 3 original patients, Martha, Arthur, and Dorothy, continued to progress remarkably. Martha had been discharged from the hospital and was living with her daughter, but she visited the hospital regularly as a volunteer. Arthur had also returned home and resumed social activities he had abandoned after the loss of his wife. Dorothy completed her physical therapy with total success and returned to living independently. One day, the 3 patients organized a special visit to the hospital to personally thank the entire team involved in their treatment. Sarah was deeply moved to see them so recovered and full of life. "Sarah," said Martha, holding the nurse's hands, "you gave me back my will to live. I can't even imagine where I would be if you hadn't tried something different." Arthur nodded in agreement. "Nurse, you saved not only my life but also the quality of life for my entire family," he said. "My children were desperate watching me waste away, and now they are at peace knowing I'm well." Dorothy contributed an interesting perspective. "Sarah, I spent my whole life respecting rules and protocols," she said. But sometimes you need someone brave enough to break the rules when they aren't working. The meeting was witnessed by Margaret, Richard, Thomas, and several other hospital professionals. Seeing the long-term results of the treatment definitively solidified institutional support for the program. "Sarah," Margaret said at the end of the visit, "the administration has decided to make your program permanent. We want to expand it to other departments and train more professionals." The news was met with applause from the entire team present. Sarah could hardly believe the transformation that had occurred in her career and in the lives of the patients. During the following months, the sensory reconnection therapy program expanded rapidly. Sarah was promoted to coordinator of a new department dedicated exclusively to innovative therapeutic methods. She worked with a multidisciplinary team that included psychologists, neurologists, physical therapists, and even occupational therapists. The program's success also attracted external attention. Local newspapers published stories about the hospital's innovation, and other hospitals in the region began requesting consultations to implement similar methods. Dr. Richard was invited to present the results at a national geriatrics conference. His lecture, titled "Unconventional Sensory Stimuli in the Treatment of Geriatric Depression," was one of the most attended at the event. "Colleagues," said Richard during his presentation, "sometimes the greatest medical discoveries come from the most unexpected places. What began as a protocol violation became a revolutionary therapeutic method." The lecture was followed by an intense question-and-answer session. Doctors from across the country wanted to understand how to implement similar techniques in their own hospitals. Dr. Nancy Palmer, a geriatrician from Chicago, asked a question that summarized the feeling of many present. "Dr. Richard, how can the medical community be more open to innovations that come from non-medical professionals?" she asked. Richard reflected carefully before answering. "I think we need to remember that medicine is fundamentally about caring for people," he said. "And sometimes those who are closest to the patients have insights that we doctors might not perceive from our offices." The response sparked a rich discussion about hospital hierarchy, interdisciplinary collaboration, and the importance of valuing contributions from all healthcare professionals. While Richard was presenting in Chicago, Sarah was implementing a new phase of the program at the hospital. With administration approval, she had begun training patients' family members to apply simplified versions of the therapy at home. "Mrs. Linda," Sarah explained to a patient's daughter, "what we do here is teach your father's brain to reconnect with the present. You can help by continuing some stimuli at home." The family training program was an even greater success than expected. Relatives reported that not only did patients maintain improvements after hospital discharge, but the entire family felt more connected and involved in the healing process. Mr. Arthur Parker, age 79, and his wife Gladys, age 76, were one of the first couples to participate in the family program. Arthur had been treated for post-heart attack depression, and Gladys learned techniques to support his recovery at home. "Sarah," said Gladys during a follow-up appointment, "this completely changed how we deal with problems. Now, when one of us is sad or worried, the other knows how to help in a practical way." Arthur complimented his wife's observation. "It's as if we've learned a new language to care for each other," he said. "After 50 years of marriage, we're still discovering new ways to connect." These accounts motivated Sarah to expand the program even further. She began developing workshops for professional caregivers, courses for nursing students, and even lectures at schools about the importance of human connection in elderly care. The program's impact was also reflected in the hospital's metrics. The readmission rate for geriatric patients decreased significantly. The average length of stay was reduced by 30%, and patient and family satisfaction reached record levels. Dr. William Foster, clinical director of Cedar Valley Hospital, was so impressed with the results that he decided to invest in formal research on Sarah's method. He contacted Blue Ridge University to establish an academic research partnership. "Sarah," said Dr. William during a meeting, "we want to transform this hospital into a center of excellence for reconnection therapies. Would you be willing to lead an official research program?" The proposal represented a unique opportunity for Sarah. She could not only continue applying the method, but also contribute to the scientific development of the field. I accept, but on one condition, Sarah replied. I want other nursing professionals to have the opportunity to lead research as well. Often, they are the ones closest to the patients and can have valuable insights. Dr. William readily agreed. Sarah's proposal was aligned with the hospital's new philosophy of valuing contributions from all professional levels. The research program was launched 6 months later, with Sarah as the lead coordinator and a team of 10 researchers from different specialties. The first official project would be a randomized controlled study on the efficacy of sensory reconnection therapy compared to conventional treatments. Dr. Jennifer Brooks, the psychologist who had evaluated the first patients, joined the research team as a psychological assessment specialist. Sarah, it's incredible to see how an accidental discovery has turned into a serious line of research, said Dr. Jennifer during the team's first meeting. Do you have any hypothesis about why the method works so well? Sarah had reflected a lot on this question during the previous months. I think we work with several layers simultaneously, she explained. There's the physical stimulation, which awakens the nervous system. There's the playful element, which reconnects with positive memories. And there's the demonstration of personalized care, which breaks the feeling of isolation. Dr. Thomas Miller, who was also part of the research team, added a neurological perspective. From a neurological standpoint, unexpected stimuli can indeed interrupt depressive patterns in the brain, he said. It's like a reset that allows new neural circuits to form. The combination of different professional perspectives significantly enriched the theoretical understanding of the method. The team began developing research protocols that could scientifically confirm their hypotheses. While the formal research was being structured, Sarah continued applying and refining the method in the daily hospital routine. Each new patient brought new learnings and opportunities for improvement. A particularly challenging case was that of Mr. Howard, an 85-year-old man who had developed severe depression after losing his sight due to diabetes. His situation was complicated because visual stimuli, which were important for other patients, did not work with him. Mr. Howard, Sarah said during the first session, let's try a slightly different approach with you. Instead of focusing only on water-based stimuli, Sarah experimented with a combination of tactile sensations, soft sounds, and even specific aromas. Howard's wife mentioned that he had always loved the smell of fresh coffee, so Sarah incorporated that into the treatment. What is that smell? Howard asked during one of the sessions when Sarah brought freshly brewed coffee into the room. Coffee I made especially for you, Sarah replied. Your wife said you always loved it so much. Howard smiled for the first time in weeks. The familiar aroma transported him to memories of quiet mornings at home, having coffee with his wife before starting the day. It's been a long time since I've felt this, he said, inhaling deeply. It's as if I had forgotten that I can still take pleasure in simple things. The case of Howard demonstrated the importance of personalization in treatment. Sarah began developing specific protocols for different types of sensory limitations, significantly expanding the method's reach. The adaptation for patients with visual impairments included varied tactile stimuli, personalized sense based on each patient's individual preferences, and even small variations in ambient temperature. For patients with hearing loss, they developed gentle vibrational stimuli and enhanced visual communication. Each adaptation required careful studies and detailed documentation. Sarah worked with occupational therapists to create personalized sensory stimulation kits that could be used with different types of patients. The program also began attracting international attention. A hospital from Portugal sent a delegation to study the method, and clinics in Chile expressed interest in implementing adapted versions of the program. Dr. Patricia Sterling, a geriatrician from Los Angeles, spent 2 weeks at the hospital as a guest observer. Sarah, said Dr. Sterling after observing several sessions, what impresses me most is how you've managed to keep the human aspect at the center of the treatment, even when formalizing it scientifically. That was always our main concern, replied Sarah. We wanted science to validate our method, not replace it. Dr. Sterling documented the program in detail for implementation in Spain, but also contributed insights about cultural adaptations that might be necessary. "In Spain, we have a very tactile culture," she explained. "Perhaps we can incorporate more physical contact, like holding patients' hands during the stimuli." These discussions helped Sarah realize that the method needed to be flexible enough to adapt to different cultures and social contexts. She began including cultural considerations in the training protocols. 1 year after the official program began, Sarah was invited to present the results at an International Health Innovation Congress held in Miami. It was the first time she would speak to an international audience, and she was naturally nervous. "Richard," she said a few days before the presentation, "what if I can't properly explain how everything works?" Richard smiled affectionately. He had followed Sarah's entire evolution, from the rebellious nurse who used a water pistol to the internationally recognized research coordinator. "Sarah, you don't need to explain everything," he said. "You need to share your passion for the patients and your practical experience. The rest will follow." Sarah's presentation was titled "Human Reconnection, When Simple Care Generates Extraordinary Results." She decided to begin by telling the story of Martha, the patient who had inspired everything. "2 years ago," began Sarah, speaking to an audience of 500 healthcare professionals from 30 countries, "I was a desperate nurse trying to help a patient who seemed to have completely lost the will to live." She narrated the entire journey, from the accident with the glass of water to the development of formal scientific protocols. The silence in the audience was absolute. Everyone was completely absorbed in the story. "What we learned was that sometimes the simplest methods are the most powerful," Sarah continued. "But we also learned that simplicity does not mean a lack of scientific rigor." At the end of the presentation, she received a standing ovation that lasted 5 minutes. During the Q&A session, doctors from various countries wanted to know how to adapt the method to their local realities. Dr. Robert Graham, a geriatrician from New York, asked a question that reflected the curiosity of many present. "Nurse Sarah, do you believe your method can be applied in cultures very different from the American one?" Sarah reflected carefully before answering. "Dr. Graham, I think what we've developed isn't specific to the US," she said. "It's specific to humanity. All cultures value connection, care, and personalized attention. The techniques may vary, but the principles are universal." After the presentation, Sarah was approached by representatives from international health organizations interested in including the method in global programs for improving geriatric care. Dr. Kimberly Young from the World Health Collective expressed particular interest in the program's potential for developing countries. "Sarah," said Dr. Young, "your method is especially attractive because it is low cost and highly effective. That is exactly what we need to expand access to quality geriatric care." The conversations with international organizations opened new possibilities for Sarah. She began to envision creating a global training program that could bring the method to hospitals around the world. Back at the hospital after the conference, Sarah found a surprise that moved her deeply. Martha, Arthur, Dorothy, and other patients who had been treated by the method had organized a party for the program's 2-year anniversary. "Sarah," said Martha, speaking for the group, "we wanted to show that you didn't just save our lives, but you also created a family." During the party, each patient shared how the program had impacted not only their recovery, but also the lives of their families. Many had become volunteers at the hospital, helping new patients going through similar situations. Arthur had started a support group for recent widowers, using techniques adapted from the program to help others process grief in a healthy way. Dorothy had returned to school and was taking a course to become an elderly caregiver, inspired by her experience at the hospital. "Sarah," said Dorothy during the party, "you didn't just heal me. You gave me a new profession and a new life mission." The party also included the participation of the entire medical team that had supported the program's development. Margaret, who had initially resisted the method, was now one of its biggest advocates. "Sarah," said Margaret in an emotional speech, "you taught me that being a good supervisor isn't just about enforcing rules. It's knowing when the rules need to be changed to better serve our patients." Richard also gave a reflective speech about the journey they had taken together. "When I caught Sarah with that water pistol 2 years ago," he said, prompting laughter from the audience. "I never imagined we were witnessing the birth of a revolution in geriatric care." The party was covered by local newspapers and television channels, further increasing the program's visibility. The reports highlighted not only the technical aspects of the method, but also the profound human impact it had generated. One of the reports included interviews with patients' family members, who told how the program had transformed the entire family dynamic. "Before the treatment," said Rachel, a patient's daughter, "our family was saying goodbye to my father. After Sarah's program, we gained several more years with him, but years of quality with joy." The media recognition brought new responsibilities for Sarah. She began receiving invitations to speak at universities, consult for other hospitals, and even proposals to write a book about her experience. "Richard," Sarah said a few months after the party, "sometimes I feel a bit lost with all this recognition. All I wanted was to help a few patients." Richard understood perfectly Sarah's conflicting feelings. "Sarah, you have the opportunity to help not just a few patients, but thousands of patients around the world," he said. "It's a great responsibility, but also a rare privilege." Sarah decided to accept the expanded responsibility, but in a way that kept her original values. She established a non-profit foundation dedicated to training healthcare professionals in human reconnection methods. The Martha Harrison Foundation, named in honor of the first patient, was officially launched on the program's 3rd anniversary. Martha herself, now 81 and still very active, was named honorary chair of the foundation. "Sarah," said Martha during the launch ceremony, "when you sprayed water on me that day, you also planted a seed. Today we are seeing that seed grow into a tree that will bear fruit for people all over the world." The foundation established partnerships with hospitals in 15 countries, created fellowship programs for healthcare professionals from underserved communities, and developed educational materials in 8 different languages. One of the foundation's most significant projects was the creation of mobile clinics that brought the program to rural communities without access to specialized hospitals. Sarah personally supervised the launch of the first mobile clinic in the Appalachia countryside. "Mrs. Hattie," Sarah said to an 89-year-old woman living in a small town 300 kilometers from Asheville, "we came here because we believe every person deserves compassionate care no matter where they live." Mrs. Hattie had fallen into depression after losing her eyesight and becoming dependent on her children for basic activities. The adapted treatment, which included familiar auditory and tactile stimuli, helped her regain interest in life and even develop new skills that compensated for her vision loss. The success of the mobile clinics caught the attention of government organizations. The Department of Health Services expressed interest in including Sarah's method in public elderly health policies. Dr. Kenneth Palmer, Director of Health Policy at the department, visited Cedar Valley Hospital to see the program firsthand. "Nurse Sarah," said Dr. Kenneth, "we are considering including sensory reconnection therapy in the National Geriatric Care Guidelines. This would mean training thousands of professionals across the country." The proposal represented the definitive recognition of the method at the highest level of U.S. health policy. Sarah was honored but also concerned about the responsibility of scaling the program while maintaining its quality. "Dr. Kenneth," she replied, "I accept the collaboration, but I need to ensure the human essence of the method is preserved. It cannot become just another bureaucratic protocol." The department agreed to work with Sarah's foundation to develop a gradual and careful implementation program. They would start with pilot projects in 5 states, rigorously monitoring the results before expanding nationally. During the preparation of the national program, Sarah often reflected on the extraordinary journey she had taken. From a nurse who was almost fired for using a water pistol, she had become an international reference in hospital humanization. But what made her proudest wasn't the awards or recognition. It was knowing that every day hundreds of professionals around the world applied her method to reconnect patients with life. "Richard," she said one morning, watching a new class of nurses being trained in the method, "do you think Martha imagined on that first day that she was helping to start all this?" Richard smiled, watching the same scene that had repeated itself hundreds of times over the past years. "I think she knew she was being cared for by someone special," he said, And sometimes that's all we need to plant seeds of transformation. Sarah Jenkins's story had become much more than a medical success case. It had become a symbol of how the courage to question established protocols, combined with genuine human care, can create deep and lasting change. 5 years after that morning, when Richard caught her with the water pistol, Sarah was standing before a new class of 200 healthcare professionals from 20 different countries. Martha, now 83 years old, was sitting in the front row, smiling proudly. "When I began this journey," Sarah said to the international audience, "I only wanted to help one patient who seemed to have lost hope. Today, we are all here because we believe every person deserves to be seen, heard, and cared for in a unique way." She paused, looking at Martha, who gave a discreet nod. "But the most important thing I learned is that healing doesn't only happen when we apply the correct technique," Sarah continued. "Healing happens when two people truly connect, when one says to the other, 'I see you, I care about you, and I will do everything I can to help.'" The program that had been born from a desperate act of compassion had transformed into a global movement for humanization in healthcare. But for Sarah, the measure of success remained the same, the sparkle in the eyes of every patient who regained their connection to life. At the end of her talk, she always finished with the same words that had become the Foundation's motto. "Remember, sometimes the most powerful medicine doesn't come from a laboratory or a textbook. It comes from a heart that refuses to give up on another heart." End of story. Now tell me what you thought of this inspiring story. Do you know someone who works in healthcare or who has lived through a similar situation? Leave your comment sharing your experience or opinion on how small gestures can transform lives. Your participation is very important for our community. Don't forget to leave your like and subscribe to the channel so you don't miss other moving stories like this one.